Now, how do you basically define this condition, which causes a permanent loss of vision in the eye and is known as glaucoma? Glaucoma is usually characterized by an increase in the intraocular pressure. So basically, it can be defined as a group of diseases that is going to damage the eye or that is going to damage the optic nerve and is going to result in a permanent loss of vision. Usually, the main characteristic for the diagnosis of the glaucoma is the rise in the intraocular pressure, which is obviously calculated by different methods that are inculcated by the clinicians to measure the pressure that is built up in the vitreous humor. So that is what we're going to discuss over here in this very first section. Now, usually this condition, which is known as glaucoma, it is usually congenital and it is inherited. So there is usually a family history associated with this condition. When you are taking the history from the patient, he or she will give you a complete detailed history of any close family relative who has suffered from this condition. So usually it is connected to the genetic predisposition, which make the person more prone to the development of this condition. But obviously, the patient usually presents later in the almost in the third or in the fourth decade of life. Why does this happen so? Because the loss of vision usually starts off peripherally. So it's usually a peripheral vision loss and is not noticed by the patient. By the time he notices that vision loss, the vision loss has entered the central vision as well. So usually the condition has progressed, and sometimes it is very difficult to deal with such conditions. As early the diagnosis is, as better the prognosis will be for the different treatment modalities that are available right now, may it be the medical treatments or the use of the eye drops, and sometimes it is coupled up with the surgical treatments to have a better outcome in a particular patient that we're talking about. So usually the outcomes depend upon the early diagnosis. As early the diagnosis will be made, a much better treatment plan will be planned or will be designed for that particular patient that we're talking about. Usually it can be cured. It is a curable disease. The surgical and the medical managements are available out there to treat this condition. So over here, in this very first section, first of all, we'll define this condition, obviously. What are the parameters by which we say that the intraocular pressure has risen to a level that it is basically going to damage the optic nerve and is going to basically result in a permanent vision loss in that particular patient. So over here, we'll be discussing this, the definition of glaucoma and obviously the affected parts of the eye. By this increased intraocular pressure, there is a rise in the pressure in the vitreous humor or in the vitreous chamber of the eye, which is going to subsequently damage the retina as well as the optic nerve, which is basically taking the signals back to the occipital cortex, and that is basically, that nerve is going to be damaged in these cases. What are the different types of glaucoma? That will be all obviously subsequently discussing in this section in quite a detail. So this is the view that is usually seen on the right. As you can see over here, you can see that it is basically affecting the peripheral vision in the person. This is a normal person seeing or looking at the same picture, and this is the person who has glaucoma. It is basically affecting the peripheral vision of the person. So these are also known as hot splinters at some time. Why is this name given to them? It's usually due to the hotness or the rubor that is caused by the inflammation, by the rise in the vitreous, by the rise in the intraocular pressure in the vitreous chamber. So that is why in the layman terminologies, this terminology, which is known as the hot splinters, is usually used to term the glaucomatous condition. How do you define this condition is again very important, as I've already emphasized on the fact that it's basically a group of diseases It can be congenital, it can be an acquired condition after a traumatizing factor, after an infectious state. It can follow basically any infectious state of the eye, and the intraocular pressure can rise in the vitreous chamber even after any infection, even after any insult towards the vitreous chamber of the eye. It is basically a group of diseases that is caused by the damage to the optic nerve and that can gradually eliminate all sight. So the subsequent damage towards the optic nerve, it's the mainstay that the optic nerve has to be damaged by these group of diseases, which is basically due to the raise in the intraocular pressure. And this permanent vision loss has to be there, has to be seen over there. As seen in this diagram, you can see that the rise in the intraocular pressure over here is going to put pressure or is going to traumatize the optic nerve. That is going to result in a permanent damage towards the optic nerve. Now, what are the affected parts of the eye? When we when we take a look at the visual pathways, we can see that there is an optic nerve over here that is basically carrying the messages from the eyeball, from the retina of the eye. And on the ipsilateral side, there is going to be no decussation. And over here, medially, there is going to be decussation towards the opposite sides. And then there is a lateral geniculate nucleus on the right as well as on the left. And then finally, there is a primary visual cortex in the occipital region that is going to relay the messages. So this is the complete visual pathway that we have to keep in our mind, and that we have to see what are the typical parts of the eye that are affected by the rise in the intraocular pressure in this glaucomatous condition, and that is going to subsequently result in the permanent loss of vision. The first and the foremost entity is the optic nerve. Obviously, it is going to be damaged by the increased pressure in the vitreous chamber, and that is going to subsequently result in the permanent vision loss. And then the ciliary bodies can be affected as well. And as I've already emphasized, the ciliary bodies, they play an important role in the accommodation reflexes. So if these ciliary bodies are affected, that is again going to result in a permanent vision loss of the person. The angle of the anterior chamber can also be affected in this way. So all of these structures can be affected whenever we say that there is an increase in the intraocular pressure in the vitreous chamber. Even the anterior chamber is affected by this rise in the intraocular pressure. May it be the ciliary bodies, may it be the angle of the anterior chambers, and if this angle of the anterior chambers and the canal of sclems are basically present in these angles of the anterior chamber that are basically responsible for the vitreous humor and the aqueous humor that is basically circulating in the anterior and in the vitreous chamber. So if these canals of sclems are basically not capable or not functional due to this distortion in the angle of chamber, that is going to further deteriorate the condition, and that is going to further increase the intraocular pressure in the vitreous chamber. So basically, it is a vicious cycle that starts off just by this phenomena that the intraocular pressure in the vitreous humor has risen. So the types of glaucoma, if we have a look at it, you can see over here in this diagram that there is a drainage canal blockage that builds up fluid in the anterior chamber, and this is basically a healthy canal in which we can see a normal flow of the aqueous humor, the drainage canals, which are also known as the canals of sclem. So they are very important, and being or having the patent canals of sclems in the angles of the anterior chamber, this is very important for the functionality of the aqueous humor that is basically flowing through the anterior and as well as the vitreous chambers. There's an increase in the damage of the blood vessels, and as well as the blood vessels are also damaged on the retina, as well as the optic nerve is damaged due to the pressure that is building up in the vitreous chamber. So this is the complete pathophysiology that we were talking about, that is basically going to result in an increase in the intraocular pressure in the vitreous chamber. So the types can be linked towards the causative factors that are basically resulting in this basically the resultant increase in the intraocular pressure in the vitreous chamber. It can be congenital cause. So the genetic predisposition is always there. Having or writing down the complete detailed family history, the socioeconomic history, is very important whenever you are taking the history from a patient of glaucoma. The adventitious formation of this glaucoma after there is some sort of an inflammatory response, and that is going to result in a blockage of the canals of sclems in the anterior chamber or in the angle of the anterior chamber, is very important, and that is one of the types of the glaucoma. Then there is a progressive disease, and obviously usually even there is an overlay between the congenital, the progressive, and the adventitious types of these diseases. Sometimes the disease can start off as only being the congenital form of the disease, and then moreover, as the disease progresses, it can move on to the adventitious types of the phenomena. Sometimes it is stable when managed medically. So usually the medical management, if it has started early as possible, the diagnosis is made as early as possible. The treatments have started, the outcome is mostly, or the prognosis is much better in these cases. So this is basically an eye which has glaucoma, and comparing this eye which has glaucoma towards an eye which has cataract. So you can see over here that there is a normal iris that can be visualized over here, and over here you can see, if you visualize this cataract, you can see that the lens has completely opacified in this condition which is known as cataract. And on the other hand, in glaucoma, we visualize a normal lens which is placed medially inside the iris. So the lens is completely normal, but the vision is affected in case of glaucoma. So these are the differentiating points clinically that make the condition more obvious, whether the person is suffering from a condition of cataract or whether he's suffering from glaucoma. Both are basically the causes of the slow or the chronic vision loss. So both of them are the causative factors, and one should know how to distinguish between these two causes clinically, as well as after performing the different tests, after performing the fundoscopy, after calculating the intraocular pressure in both of the eyes. Sometimes the intraocular pressure rises even in the cataract condition, but not to the levels that it is damaging the optic nerve. So these are the differentiating points that make the condition more clearer in these two states. It is an inherited condition appearing in infants and incomplete development of the drainage canals during the prenatal period. So these are the characteristic features for a congenital kind of a glaucoma. Usually there is an incomplete development of the drainage canals that is basically responsible for a blockage in the flow of the aqueous humor, and that is going to subsequently result in an increase in the intraocular pressure. Then on the other hand, we have the secondary causes of glaucoma. They can result from the other causes such as drugs, injury, tumors, and inflammation as well on the other hand. So we can say that the causative factors over here can be the inflammatory responses, can be the acquired conditions in the lifestyle of the person. So again, as I've already emphasized, taking the socioeconomic history from the patient is again very important. Any history of trauma, whether he has suffered from some sort of a surgery or some sort of a traumatizing or accidental conditions, that can again result in a secondary kind of a glaucomatous condition. So the inflammatory conditions can also be visualized, whether he has suffered from any other chronic inflammations, for example, keratitis, uveitis. All of these conditions can subsequently result or can subsequently manifest as an increase in the intraocular pressure in the vitreous chamber as well. So talking about the open angle glaucoma, we have an angle closure glaucoma, one of the emergency states that require sometimes, mostly it requires a surgical treatment. And on the other hand, we have the open angle glaucomas. The open angle glaucomas are usually caused by the blockage of the trabecular meshwork, which slows the drainage of the aqueous humor, which increases the intraocular pressure. So this is the pathophysiology behind it. Usually the canals of the sclem are patent in these conditions, but the trabecular meshwork is blocked, and that is basically going to result in the increase in the intraocular pressure. It is the most common form of glaucoma over here. The correct amount of fluid cannot drain out of the eye. It is basically just, in the layman terminology, you can visualize a clogged pipe. So this is the situation over here when we talk about the open angle glaucoma over here. And on the other hand, when we differentiate it from an angle closure glaucoma, what happens over here is there is a blockage of the trabecular meshwork and slows the drainage of the aqueous humor, which increases the intraocular pressure again in this condition. It is the rarest form. The eye pressure rises quickly when the drainage canals are blocked or covered, just as you can visualize a sink stopper over here. So it's a complete blockage that is usually visualized over here in the angle closure glaucoma type. So over here in this section, we give an overview about this condition, which we usually call as or term as glaucoma, and what are the different risk factors that make the person more prone to the development of this glaucomatous condition. And then finally, the types of glaucoma, mainly the open angle glaucoma, and then on the other hand we have the angle closure glaucoma. So that is the end of this section. Thank you for watching sqadia.com.